Can you tell us about the vaccines that are starting to become available? And what are the pros and cons of the J&J, Moderna, and Pfizer vaccines? Dr. Muntu and Tracyville.
Thank you, and I really appreciate everyone taking the time to come here tonight. I want to start by really just talking about the vaccine itself in terms of thinking about the risk. We've been asked this question about why not, just get infection and be protected that way versus, getting the vaccine. So if you look at this data, if we look at the million cases that we've gotten so far, we've had 15,000 deaths. So 15,000 deaths per every million cases of infection. And we've had over 70,000 hospitalizations for every million cases of COVID-19 infection. When we look at the vaccine, for every million vaccines that have been given, there have been 2 or 3 serious reactions. And the serious reactions are that someone needed epinephrine in terms of the allergic reaction to it, or required hospitalization to manage that. And there's been 1 to 2 hospitalizations out of every million COVID-19 vaccines. And there have been 1 to 2 deaths that have occurred after vaccination, and those are still under investigation. I do acknowledge that even during the trials, through both the group that received the vaccinations as well as the group that did not receive the vaccinations, there were also deaths, but none of those deaths were attributed to the vaccine. And oftentimes more of the deaths were seen in the placebo group, meaning natural causes, than there was in the vaccine group, which were also natural causes. But I just want to put this in perspective just in terms of infection versus vaccination. Now, we want to talk a little bit about, people have asked questions about the different vaccines and how they were tested and who they were tested on. And so this actually is data from all 3 vaccines in terms of their clinical trials. And as you can see, the group was diverse, and the one group that's not listed on here is white, but you can gather that they were a majority of the percentage. But most importantly, when we look at the different races and ethnicities that were also in the trials, you see they're pretty diverse, and in many instances mirror what we have in terms of our population here in Los Angeles County. And as the vaccines went through in terms of those trials, there were no differences in terms of how good the vaccines worked for any of these groups. Nothing different in that regard. So the protection that you see and you hear about was good across all groups and across all age groups as well. Now I want to talk a little bit about, before I talk a little bit about the eligibility, in terms of the history, when we look at what's in place in terms of these vaccine trials and what's there to protect us, there is an institution review board that has lay people as well as doctors and scientists who must review the proposal for a study before it is approved to actually be done. During a study, there are also people who are reviewing it in terms of the medical board to also review it and make sure all safety mechanisms are followed and there's nothing that is odd about the study in terms of what's being done. And then after it, the study results are published and reviewed by the FDA, the Food and Drug Administration, to determine whether or not it is safe and effective in terms of its use. And that's what happened with all 3 of these vaccines moving forward. No steps were skipped. The question about whether or not this vaccine was produced quickly, it is actually produced simultaneously. So as the vaccine was being produced, studies were also being done. Funding went in from the federal government as well as from private industry to support these companies to make the vaccine. So at the time that it was approved, they were ready to be shipped if they did get approval. So it was loaded up front in terms of funding that took out that risk for these companies in order to make the quantities that they made in order to be ready to ship soon after they received their emergency use authorization. Now, thinking about the groups that are eligible right now, these are the groups that are currently eligible to receive the vaccine. And I will say that a lot of this has been determined both on the basis of risk of exposure in terms of getting the infection. And so our healthcare workers and our healthcare workers, both in long-term care facilities, as well as in hospitals, clinics, and others who are taking care of people with COVID-19 were deemed, that highest at risk of getting the infection. But we also noted that across the nation, our residents who were in skilled nursing facilities were dying at a much higher rate than anywhere else inside of our population. So that group was also chosen as the first groups to receive it, understanding that the vaccine supply was not enough to give to everybody. So they used these principles in terms of determining who was at highest risk. Then the next group of eligible population is our residents 65 and older. Again, the group being hospitalized more often and also dying more often from COVID-19 infection. And then in terms of risk, looking at our sectors, education and childcare, emergency services, and food and ag, thinking about what's needed to support our community, some of the basic things that are required for all of us to be safe, and those things being put in place as well. Now, coming up on March 15th, the state has said that it's going to move to age 16 to 64, as well as certain severe underlying medical conditions. And we'll look to see more information related to that. But there is some initial information on the state's website at covid19.ca.gov. When we look at where a vaccine has been distributed in terms of by race ethnicity inside of our county, as of February 20th, this is the breakdown in terms of those who have received at least one dose of vaccine. And as you can see, there are certain groups here that don't represent the breakdown in terms of our Los Angeles County population. And that could be numerous reasons. That could be, wanting to see what's going to happen with others, to not being able to get through the systems that were initially set up in terms of going online, and also the demand just in terms of the numbers of people and the mechanisms by which they would have been vaccinated. So not everybody has good access and is savvy on using their phone or their computer to sign up. Not everybody has the transportation to go through a drive-through in terms of the sites. And so there were walk-ups that were also needed. But again, the quantity was low. And so our ability to have lots of vaccine out in different mechanisms was limited by that supply. But we did have it in different places. And so this is where we were as of February 20th. Now, some good news. As we started to move forward, as more vaccine came in, as we expanded our mechanisms, and as we had more partners. And at this point, we have, I believe, over 500 places that can provide vaccine across LA County. As Mayor Garcetti mentioned, it's more than any other jurisdiction that we're aware of in terms of a large jurisdiction, the number of sites per capita that we have here in Los Angeles County. But notice these increases. In terms of 65 and older receiving at least one dose, as you can see over the weeks leading up to February 20th, the percentages increased. In particular, the highest percentage of increases were seen in our African American Black population, followed by our American Indian, and then followed by our Latino population in terms of the relative increase from where they started to where they ended up in terms of the percentage of population 65 and older who received one dose. So the partnerships that we had in the community and the changes that we did were improving those vaccination rates. Here's some examples of some community collaborations that have been done, and many of these have done these either on their own or in partnership directly with us. And a lot of these groups have done things to stop having people game the system. We noted that a lot of clinics said, look, we're seeing people that we didn't normally see that aren't normally in our communities actually coming to our place to get vaccine. And so as the mayor talked about the codes getting slipped out and not going to the populations that they were intended to go to, many of these community groups and faith-based organizations have stepped up and done something that doesn't allow for that to happen, but ensures that the vaccine and those appointments are getting to the people who they are intended for in the areas that they're intended for. And they've done everything from facilitating making appointments for people to being locations that may serve as a mobile vaccination site. We have also done some education programs to allow people to understand more about COVID-19, as well as to be able to teach and talk to their community members or their organizations, and that is our COVID-19 Ambassador Program. And we can get more information related to that. I don't have the information readily available on how to contact, but we'll have that information available on our website if it's not already. We continue to have discussions like this so we can answer your questions related to vaccine. And this is from the feedback we've gotten so far has been helpful to have people ask direct questions and be able to answer those in that moment. And so as we continue to move forward, even after you're vaccinated, and it's not the happiest message for all, we're going to need to continue to wear our face coverings and keep our distance and avoid crowded spaces, because we have variants to this virus that are circulating and are potentially taking more hold in other places. We are seeing increases in other states related to infections. It's one of the first times that we're seeing increases. And so we have to all continue to follow these same steps until we get more information and see what's going to happen and whether or not these vaccines are going to keep us protected for those who get it, and make sure that we continue to keep these case counts going down, because we want to do more in terms of opening and getting more back to normal from what we were before this pandemic first started. I do want to put this number up for those who are currently eligible, who have disabilities or don't have computer access. You can call this phone line between the hours of 8 a.m. and 8:30 p.m. 7 days a week to look to get information and assistance with appointments. And sometimes this phone line has been bombarded in terms of calls. We're trying to improve that system and also trying to make sure as more appointments become available, they are allocated so people calling in can get their appointments through calling this phone number. And we ask that if you don't have computer access and you have disabilities, or you have disabilities, if you have computer access, don't call this phone number. If you don't, this is really targeted for those who really don't have that access. And so we would appreciate everybody respecting that and allowing for those who don't have computer access to use this line. In order to get more information about what's happening, the VaccinateLACounty.com website will provide plenty of information about the vaccines, as well as how to get vaccinated, safety questions as well. And for those in Spanish, it's vacunatelosangeles.com.
When we look at the COVID vaccinations, what precautions should people consider when taking the vaccine? And is there an understanding of which vaccine is best for certain health modalities like COPD, emphysema, asthma, lupus, diabetes?
No, there's not a lot more detail in relationship to that. None of the vaccines are shown to be more effective for particular underlying health conditions. They were all effective across the various underlying health conditions among the study populations. And then in terms of there are differences in terms of the Pfizer and the Moderna are what they call mRNA vaccines, and the J&J or Janssen vaccine is what's called a weakened adenovirus vaccine. But they all give the same effect in terms of providing protection. Again, there was no difference in terms of them being more effective in any particular group or with any particular underlying health condition. Your question also said, what should people watch out for? And really all of these vaccines, unless you have had a severe allergic reaction or an immediate allergic reaction to some of the ingredients, which are listed in the information sheets, for each vaccine, or you've had some allergic reaction to another injection, and even there, we can watch you. But if you had a severe allergic reaction to, or an immediate allergic reaction to any of the ingredients, then you shouldn't get the vaccine. But otherwise, after people get the vaccine, we do screen beforehand to make sure that it's okay to give. And we do observe you for 15 to 30 minutes, depending on if you've had a severe reaction to any other vaccine in the past, to make sure that you're okay after you do receive your vaccine.
We do continue to follow up with you once you've had the vaccine. You might get a phone call or text messages for a number of days so we can monitor.
Excellent. So I want to go back to the question from Erica Smith at the LA Times. Johnson & Johnson has been getting a lot of publicity about their vaccine being released. How will the Johnson & Johnson vaccine be deployed within the county of Los Angeles at sites across the city or county, and will it be targeted to specific neighborhoods and or people?
The answer is no. We know that for some it may be better just because they want to do one dose and not have to worry about coming back 21 days or 28 days for the others. It should be available at all of the different types of sites. I think a lot of this is just going to depend on how much we get and the capacity of the various sites in order to do stuff. It may work better at some mobile sites if you know, so it could be at any one of those. But we'll make those decisions as we get it. And as we get vaccine, we start off making sure that for Pfizer, Moderna, the second doses are provided to those vaccine providers. And they may not have room or capacity to add the Johnson & Johnson onto what they already do. But it should be widely available and at different locations.
Excellent. So earlier you heard Superintendent Pastor Anthony Williams indicate that he had COVID, and with much prayer and supplication to get through that from his friends and himself and his congregation. Should someone who had COVID get the vaccine, and if so, at what point?
So the answer is yes. So as long as you've had COVID, you've passed your isolation period, you're able to then get it. And it is recommended that even if you've had a COVID infection, that you be vaccinated. But you got to get through that period so that you don't infect others when you go in.
Okay. So looking ahead, you know, we've heard a lot of news about the impacts of COVID from a health modality standpoint, with people ending up with kidney disease, ending up with heart concerns, thickened blood, lost limbs. What are we looking at down the road in terms of the impacts?
Yeah, I appreciate that question. And so the study population that did receive the vaccine, they're still being studied, they're still being observed. And as people are being vaccinated, they're also being observed in terms of reporting on any symptoms they may have afterwards. But so far, the vaccines have been safe. There hasn't been anything identified as a quote unquote long-term effect. But we're still very early in this. But the vaccines were deemed as being safe and effective at reducing or preventing serious illness and death. And that's what we saw a lot of in terms of the suffering with this pandemic in the middle of our surge.
Do your homework. He is the doctor of doctors in the county of Los Angeles. He is the person that is looked to help guide other physicians in decision making. He's the equivalent of the county of Los Angeles. His title really should be Surgeon General of the county of Los Angeles. That's what the title should be.